And welcome back. Thanks so much for tuning in. And we're having a discussion following yesterday. The South African Health Ombudsman, Professor Malegapuru Makgoba, he issued a report in response to earlier media reports and also a formal complaint that was lodged by Dr Kiran Sukeri, who worked at the Tower Psychiatric Hospital in the Eastern Cape. And I think in the main, it found that there were no similarities between what was happening there and the Life Esidimeni tragedy, and also pointed at rather more systemic failures in the approach towards mental health and how issues therewith are dealt with by the department. And this is what we're engaging Minister Aaron Motsoaledi and also Bhengukazi Shongwe, acting CEO for the Central Gauteng Mental Health Society, on this morning. So before the break, Minister, you heard Ms. Shongwe there and her concerns as a service provider on the ground, and saying that post-Life Esidimeni, it seems that your response as a department has been rather one of being reactive, and they are still continuing to experience lots of problems with regard to service delivery and also assistance from your department.
Well, Sakina, I don't know what she means by reactive, but remember, post-Life Esidimeni, there were 18 recommendations from the Health Ombudsman, and we had to implement them. We have to react to each one of them, because there was also an instruction from the Ombudsman that we need to report to him periodically the progress. And so he had to react to those recommendations, yes. If that is what she meant, we had to do that. But in terms of our relationship with NGOs, we defined that long before Life Esidimeni, Sakina. The Mental Health Summit, which I tell you about, which we held in 2013, in which the World Health Organization was also invited to come and guide us, defines our relationship with NGOs. It defines their role, because it emphasizes on community mental health services, where NGOs and communities must get involved. But under no conditions should NGOs get involved in the manner in which it happened in Life Esidimeni. It is not in that document. In fact, what happened in Life Esidimeni was a complete violation of that mental health plan, which we drew up together. And so our relationship with NGOs is very clearly outlined. But if they measure the relationship in terms of the amount of money that the state gives them, then we are going to have problems, because even us in the department itself are struggling with budgets. As you know, budgets have been cut when the country started experiencing very serious financial difficulties. So if the NGOs gauge our relationship with them through the amount of money given, then there is definitely always going to be a problem.
Ms. Shongwe?
But the issue of licenses, again, you will realize...
just complete that for us quickly, Minister.
Can I go on,
yes,
Sakina?
please complete that.
Yes, you'll realize that actually what was lacking in Life Esidimeni was the strengthening of license systems. You can't just have NGOs all over with very poor licensing. They need to be licensed so that we need to know what we are doing. Otherwise, if we don't do that licensing and it's not strict, we'll then repeat Life Esidimeni as it happened.
Just a final word, Ms. Shongwe.
Thanks for your response, Minister. I think even with the licensing, we still need your support, because as I indicated, it is not easy to attain those certificates. And the City of Joburg or the government departments are the ones who can assist us. So if it can be made easier for us, because at this stage we have beneficiaries that we need to take care of, and we need those certificates. So we need to work together, being patient with each other, see how we can meet each other halfway, because honestly, there's no budget for that.
Minister, it's 8 o'clock, so I need a very brief response from you.
Yeah, no, let them come and meet us. We'll definitely help. As I said, we do hold workshops. We have to help people to capacitate them. There is nothing wrong with that. We are quite willing to do that.
Well, thank you so much, Minister Aaron Motsoaledi, and reacting to the report issued by the Health Ombudsman yesterday. And thank you also to Ms. Shongwe, who is the CEO of an NGO operating here in Gauteng.